and hey, everybody from Dental Nachos.
Hi.
Thanks for joining me and my friend, Dr. Sonia Chopra. We're going to talk about endo success, endo stress. We're here for you. You can also ask questions in the chat. Before we get started, I want to share a few things here. If you are a newest dentist, a dental student, and you want to survive, thrive, and not cry, we put together a real-world survival guide for dental students and new grads. A new grad could be up to 10 years in practice. Just text SURVIVE to 215-543-6454. Can't do root canals without a job, right, Sonia? Can't do them on the street. There is actually an amazing barber in Philadelphia who does haircuts for the homeless on Broad Street. It's so nice, but you cannot just do endo on the street, so you do need a job. Text job to 215-798.
Well, I was just in India and I saw people getting their haircut and dentists doing dentistry on the street.
Dentistry on the streets. Wow.
Yeah,
Visit us at dentistjobconnect.com or text job to 215-798-9897. So we're going to be hanging with Sonia for the next 40 minutes, asking her questions, but she is an amazing sponsor of Dental Nachos and what we do. To join her next eSchool, text RCT to 215-543-6454. Also, if you're here on Zoom, my amazing team member will put the link in the chat. You will save by joining this amazing eSchool through Dental Nachos. And that's what I wanted to kind of start with, Sonia, before we get to our questions. You've done eSchool. If people are here for the very first time checking in on this, we have fans of eSchool in our Dental Nachos group. They've loved it. Tell us what it is, how they learn, and when the next course starts.
So eSchool is like a mini endodontic residency, all jam-packed in an online course. I took into consideration everybody's busy schedule, closing their practice. You don't have to do any of that, but eSchool opens today for enrollment, and enrollment closes on January 21st. It is really meant to take you from diagnosis to beautiful obturations in a simple, kind way. I think there's a lot of extra stuff that people throw at you that you don't really need, that overcomplicates endo. And then I also think that there's some mean ways to learn, and I don't want that for anybody. And I think endo can be a lot more empowering and a lot more enjoyable if we just kind of simplify things and teach in a friendly way.
I love it. Everything that matters needs a system, and everything matters. I love that. I would also like to share, we have a lot of people on Zoom. There's no such thing as Zoom HIPAA, so I'll violate it. I see GB here in the chat, TH, dental students. There's someone from my own hometown of Pennington, New Jersey. Please go into the chat and tell us where you're watching in from and what was the most stressful part of your dental day. We'd love to chat about that too. Now, Sonia, eSchool, tell us about eSchool plus coaching, because what we're promoting is eSchool, that is the online access, but tell us about your Zoom or online coaching that you do.
Yeah, so twice a year, I offer eSchool with coaching, which means you get to do eSchool with me. So I am your friendly mentor and I'm by your side. So there's one thing to just, digest modules and still have questions, right? So you can do things DIY, or you can do things with an endodontist who actually wants to answer your questions. So on Monday nights at 8:30 p.m. Eastern, I actually it's about a 2-hour long Zoom call, and I answer all your questions. And that's where we get really specific about your cases, about your detailed question that you really can't get the answer anywhere else.
Yeah.
So.
And you can learn from your cats. Now, I want to share a few things as we get into the questions. First, I think one of your grads is here. I won't violate total Zoom HIPAA, but her name begins with R. Also, I asked all of you to put where you're watching in from. One person did it. What is wrong with these dentists? So please go into the chat and say where you're watching in from. 2 people. And what was the most stressful part of your dental day? Someone said this, Sonia, you don't have to deal with this. Back-to-back class 2s. When's the last time you had to do back-to-back? What decade was that? Dental school?
Yeah, I think that ended in 2003 for me.
North Carolina, New Jersey, thanks for being normal, guys. Add in your most stressful part of your day. UPenn Dental, awesome. There's why you got to come back to a meeting. We have a networking event. You got to see you at that. I know who that is. Name starts with A. Myrtle Beach, nice guys. So what we're going to do here with Sonia is answer questions, but you are the most important people that are here. So if you have a question, please put it in the Q&A. But we went through a form and put questions together for Dr. Sonia. But if you have taken the time to watch in live, please add your questions in the Q&A, whether it is about eSchool, the coaching, access, obturation, anything in between, isolation. So tell us a little bit about your work schedule, Sonia. I think this is a great first question. You know, as a practice owner, A, how many days a month are you working? And B, the days that you're working, you told me before we started, you did double-digit root canals today. So how are you so efficient? So tell us how many days you work and how you are so efficient.
So I work 5 to 6 clinical days a month
Wow,
because
a month.
yeah. I like to teach eSchool and I'm lecturing a lot. So my work schedule is really dependent on all the other things going on. But I found a way to actually be more productive in less time because I got really smart about how to strategize my schedule with respect to what I'm doing during my procedure and what can I delegate to my team so I can go be productive in another operatory. And once I started to figure that out, I was able to not have guilt, production guilt, and drop a day because I was producing the same amount in one day as I was 2 days.
That's awesome. I mean, I have to
Yeah.
share, no one has, only a new mom once did say this. So I said that this filling took too short, Paul. This is my only break of the day. Can it take longer? But besides her, every patient has wanted to get out of the chair faster. Every team members want to be done on time. So being able to do more in the time you have is great. We have somebody who said their temp crown broke from Las Vegas, or patients, and a stainless steel crown on an 8-year-old, my friend from Pennington. Okay, so what was your favorite part of Super Dentist Boost Camp? We asked you that last time. You came to Super Dentist Boost Camp in Philly. We're having it again in August. We'd love to talk to you about that. I know your schedule gets booked out, but what did you like about Super Dentist Boost Camp?
I loved meeting all of my online friends in real life, which was great, and listening to all the value that they brought to the table. I learned a lot.
And if two of us are on here on Zoom, both of us do online CE, and what is the value of going and seeing your colleagues face to face? Whether you're 30, 40, 50,
Yeah.
whether you
It's
say, I
just,
don't have the time, why is it worth it to get out there face to face and go to a dental meeting and hang with your colleagues?
I think the camaraderie and
Yeah.
just the connection is just as important as the education.
Yeah, I totally believe that. You have people who have your back. I would say friends in your phone, Phipps. Lindsay will put in, people can apply to the next Boost Camp, which is happening in August of 2024. So let's talk about finding MB2 and the middle mesial canals. These are common questions I get from my audience. I am not an endodontist, haven't done a root canal in a long time, but talk to us about finding MB2 and middle mesial canals.
So I'm going to say there's a way to cheat, and it's going to be your cone beam. And I've come to the realization for the past couple of years that I really shouldn't be doing a root canal without taking a cone beam preoperatively. It saves me so much time. I think from a general dentist perspective, it's a great way to do risk assessment and that really like builds into the economics of the endodontics. So that's actually my next webinar, which starts tomorrow, the economics of endodontics, because we got to play smart with the tools that we have. And there are going to be root canals that you are going to be able to do, and there are going to be root canals that you may not be able to do, and that's okay. But being able to know which ones are going to bring you joy and the ones that are going to stress you out before you even start, because mid-treatment referrals really stink and they cost you a lot of money. And they also cost you a lot of confidence. We don't want you to have a bad experience doing a root canal so that you stop doing them moving forward. Like, I want to make sure that people have that momentum to keep going. But finding the MB2, I've broken it down into, I think, 4 steps. Number 1, everyone needs to know that it's always there. Okay. They say they're 96.1% of the time. In my opinion, that means 100%.
Yeah.
So that's step 1 in finding it. Step 2 is knowing exactly where in the tooth you need to look. And that's where your cone beam comes into place. So sometimes if you look at your cone beam, the MB1 is here and the MB2 is like right up against it. Sometimes the MB1 is here and the MB2 is like really far away. So now you know where to trough, right? Sometimes the MB2 is like, you can actually see the hole, and sometimes it looks like it's just solid dented. Those ones that are solid dented, maybe you want to kick those to the specialist and keep the ones that are nice and have that nice orifice that you can see on the scan.
What I can add in here, Sonia, you're already delivering awesome value, and do some questions from the Q&A is knowing when to refer makes you look like a hero, knowing when things are going to be tough. When I was a new dentist, I'd done a GPR, extracted hundreds, if not thousands of teeth. My dad's partner put a patient in my schedule with broken off root tips, didn't tell me about it. I had 2 hours to do it. I looked in there, I said, this is going to be miserable. I got on the phone with the oral surgeon that moment. I said to him, hey, you want to have a specialist take care of this? This was like in the 2006s, Sonia. So I felt bad that this happened, but I knew, right? I knew enough that this wasn't going to be something I could handle. So this is before cell phones. I called him that night just to see how it went. Didn't pick up the phone. Next day, he called me back and he said, thanks for checking me, Dr. Paul. Took that oral surgeon 2 hours to get all these teeth out. So just because it doesn't mean it's not hard if specialists do it. They just know how to manage that. So I love that. Question from the audience. A resource, I mean, I know we have eSchool here, and if you are like me, if you're working and you have your link, please share your link to tomorrow night's webinar in the chat along the way, Sonia. I can entertain them, or we can send it out. We'll send it out. We'll send it out with the email tomorrow morning, or text me later. But what is the best resource to learn about risk assessment in endo? What are some tips you can give the dentist in this webinar, whether it's going to eSchool, but other things about risk assessment with endo?
I think risk assessment really comes down to anatomy, because when we break it down and we simplify endo, a canal is just a canal, right? But the only thing that you cannot change is anatomy, because that's Mother Nature. So you have to get really good at understanding anatomy and the types of canal configurations that you feel comfortable. And it's going to be different for every single person. And so I just say, really understand anatomy and figure out what anatomical configurations you want to deal with, and then refer the rest.
I mean, it is interesting, even though they're kind of the opposite impact on the tooth. Extractions and endo have some of the same best practices: anatomy, identifying complications ahead of time, seeing what you want to deal with. Someone asked if you could just share again the places for MB2 that you had just shared, where to find MB2.
So it's going to be different every single tooth. That's why I say use your cone beam to cheat, because the cone beam will tell you if it's close together, if it's far apart, if it's a little this way, if it's a little that way. Everyone's looking for a recipe, but there's no recipe. So we have to figure out ways to cheat and really use our tech to help you strategize.
I like that a lot. Curved canals give me a tough time. How can I have them give me less of a tough time?
Whether your canals are straight, curved, calcified, there's really one way. There's only one way to do a canal. And if you learn that one way, which is a 1 hour conversation, if you learn that one way, you apply that same process to tight canals, fat canals, curvy canals, straight canals, and that's it. It's the same process, but that's a process that takes about an hour to teach.
Awesome. So you'll be able to learn that at eSchool and coaching. Just to kind of reinforce, and people jumped on, if people become an eSchool member plus coaching, we're sharing the chat, or they can do that, not just sponsor discount. They can literally ask you questions about cases they did that day. Yes.
And you post it in the Facebook group. I give you, it's almost like real-time answers. Sometimes, if I'm taking a shower, then, I can't really answer you, but it's pretty much almost real-time answers that I can answer in the Facebook group, or we can talk face-to-face, just like here in Zoom. So
that's awesome. And that's what we just need more of in dentistry. Dentistry is a lonely profession. You feel isolated many times, and you just need someone to know, is this normal? Is this not normal? What should I do here? Now let's go back. We talked about some of the instrumentation, access openings. Let's start with that. Tips on access openings, keeping them small, making sure that you can see some access opening best practices.
So this is probably the one thing that I agree with how dental school taught us. Access openings is the only place in endo where I'm gonna say, yep, follow the textbook. So when they say it should be triangular in shape, then make your access triangular in shape. When it says be rectangular in shape, make it rectangular. So in a lower molar, you're gonna wanna be a rectangle, and a maxillary anterior, you're gonna wanna be a triangle, and a maxillary molar, you're gonna wanna be a triangle. That is absolutely correct. And actually, you want to make it a nice tight rectangle or a nice tight triangle, because the moment you blow it out, you're actually going to lose your landmarks. You're not going to be able to crawl down the wall into that orifice. So you actually want to make sure that you don't over open, even though the thought process is, oh, I need to open it so I can see. Instead, you need to keep it tight, and you have to feel your way into the canal. Otherwise, you have a tendency to get lost.
Great tips there. So actually, I thought something as you were talking. Magnification. I mean, I know now you're using a microscope. Some dentists are using loops. This actually feedback from your participants. Is there a certain loop magnification you see a lot of general dentists using if they don't have a microscope?
So if access opening is something that is a struggle for you as a dentist, I will say that the people who use like 2.5 and 3.5, those are the ones that I see struggle. And the moment they bump up to a minimum of 5, then they start to like understand, because they can see, and you can treat what you can see a lot easier. Some people love endo so much that they do invest in microscopes, and then they do their restorative dentistry with microscopes. And that's freaking awesome. I've had people come to my office for eSchool Live, and they've never used a microscope, and they do all of their root canals during eSchool Live with the scope, and it's mind-blowing to them. So I will always be a huge advocate for enhanced magnification, but I will say you will decrease stress in endo if you have a minimum of 5.0 magnification.
I like that a lot. And what us dentists, we're very weird, right? Because we're cheap in the weirdest ways. Like I see people glue loops back together instead of buy a backup pair. And these are things you put on your face every single day. And we have a loop sponsor through Nachos. And it's like, buy yourself a pair of loops you're going to do endo with. If you do a lot of endo, you're worth it.
Yeah.
Your joy's worth it. Your patients are worth it. And, as you kind of alluded to, you're going to work more efficiently. You'll be able to be more productive. You're going to have a better time and get better results.
You're just going to get faster.
A couple words or tips on this. I know even when I was doing endo back in the day, you're always fearful of a perforation. Any tips on this? Because I know everybody doing endo saying, oh, geez, what if I perforate? One of my friends just posted a case with a post through the side of a tooth. So, perforations, whether it's endo or post, are scary. Tell us about that.
They're scary, but they're not the end of the world. You can seal up a perforation with some MTA and your tooth can still be fine. So don't forget to give teeth a chance, because just because it looks like, a horror show to you, it's actually probably fixable. And so that's one of the things I tell people, just take a breath. It's okay. We're going to get through it. But now let's see how to fix it, right?
I like that. And the cousin to the perforation, the file breaking. How about that?
Again, sometimes it's not the end of the world. It really depends on what part of the procedure it separated. If it happened at the end, it's probably not a big deal. If it happened at the beginning and you didn't really clean anything out, then it's probably a big deal. But again, if you have anatomy that joins, like you have 2 canals that join, maybe you can just bypass that canal from the joining canal. Now, if they're 2 separate, portals of exit, and one separates, now you might be in a little bit more trouble. But again, you don't have to freak out. You can bypass it sometimes. I'm not the best at removing them. I like to prevent those separations, and it is easy to prevent. Again, when you learn that process of instrumenting a canal, whether it's a tight canal, a curvy canal, an open canal, when you learn that process, you're also learning the process of prevention of separation as well.
Great tips there. Someone has a question that seems specific to me, but maybe it's not to you. For edge endo ×7, can you recommend speed or torque? I know, is that one too specific?
That's kind of specific. That's a manufacturer kind of question. So there's a gazillion files out there, and they're all going to run at different speeds and different torques. So whatever you like, your rep will be happy to give you that rec. It might be
I-
online too, somewhere.
As I get to number 8, I would like to thank Dr. Doug Wright. She was my pediatric dental attending in my GPR, and we were required to use the rubber dam for every single procedure we did on pediatric patients.
Yeah.
And it was a non-negotiable. And if you could not put it on, Dr. Rice would come over and help you put it on. And I will share, this helped me so much as a newish dentist, because you are used to this 100% of the time, but us restorative dentists, our patients can talk, our patients can close down. So tell us, but I still remember opening up a clamp, having it fly across the room, having problems. So tell us some rubber dam gagging, some tips on that. How do you deal with this? Because you got to put one on all the time. For the dentists out there that are worried about it, struggle with it, give us some tips for that.
Yeah, usually gagging's not a problem once the patient gets numb. They can't really feel it. So get them numb and let them know that they're going to feel better once they get numb. And I think just a little bit of that education and psychology, giving them that information, even when I like go to do an x-ray under the rubber dam, right? I'm going to push that sensor all the way back. But I tell the patient, you're in control. I have them hold it with their finger, and they kind of understand that they can just take that out if they need to. So I like to let them know that they have some control of the situation, and all of a sudden the gagging goes away. So between that and getting them numb, gagging goes away.
And I'm
And then-
assuming, I was confusing that, but how big a factor is having the right clamp and the right tools to rubber dam success?
It's really important. And sometimes when we overuse our clamps and we get cheap and we don't replace our clamps and they get really like wide open and they no longer hug the tooth tight enough and they start to wobble, and then you get that leakage of saliva, it gets frustrating. So if you feel like your clamps aren't working, just get some new ones. They're relatively cheap, but I think new clamps every now and then will actually lessen your rubber dam issues.
I like that. It's a theme. Don't be dentist cheap on loops or clamps. Someone asked, in terms of brands of loops, I would just, someone asked, I would just test a lot of brands, go to those loop fairs, see what works for you. We have someone who asked about gutta percha bending at the apex.
Sounds like you didn't instrument all the way to the apex.
That's the main problem there.
Yeah, or if it crinkles, you get the crinkle cone, you need to re-instrument a little bit more.
So that's a good tip. Preventing ledges.
Preventing ledges and preventing separations kind of go hand in hand. So again, when you learn a nice workflow for instrumentation, you prevent all those things.
So endo is, of all the things you in dentistry, it's consistently talking about systems, right? Is this what e-school teaches them?
Yeah.
Coaching teaches them systems for success, and then I'm assuming for systems when things go off script, like you talked about.
Yeah,
So,
and there's only a few things that can go wrong, and therefore there's only a few things that you need to know how to fix. It really can be super simplified.
so I'm just going to catch everybody up who's watching in, whether it's on demand later or live. I'm talking with my awesome friend, Nachos sponsor, Dr. Sonia Chopra. She's doing the work of the Lord G.V. Black, and she has created an endo school plus coaching, and you can get a Nachos sponsor discount. You can get it two ways. You can text RCT to 215-543-6454, or you can go into the chat right now, and there is a link and a code, Dental Nachos discount, which saves you on the course. You are worth it. Invest in you. This gets me to my next point. I believe what CE teaches in general, Sonia, and this reinforces stuff you want to do, but more importantly, things you don't want to do, right? Whether it's placing implants, maybe you want to place a single tooth implant on a number 30 with good bone, and you always want to stay away from implants that need a lateral sinus lift. But if you cannot identify those cases and you cannot build confidence, so talk a little about these two, lack of confidence coming out of dental school and case selection, some tips, and how will eSchool help them with both of those challenges?
So I think number one, dental school is required to teach you so many things that I don't know if we had like the brains at the time to really focus on all of it. But I think once you come out of school and you have a little bit of clinical experience under your belt, going back and relearning things actually is what gives you the confidence. I remember when I became a board certified endodontist, I had to go back and relearn everything. And that's the thing that made me have the confidence. So I think there's something to say about relearning a topic, especially
Yeah.
one that if you were like me, I only got a 2-week didactic course in dental school out of my 4 years, and I only had to do like 4 root canals to graduate. That's not enough.
Yeah, I actually believe, I'll say a couple things about this. One, I think there's that great quote about always have a beginner's mind. That's why it's so important to go back and reinforce fundamentals. And of all the things we learn, endo is a tough one, right? You know, it's like doing 4 root canals is going to almost make you feel stuck, right? And if your associate saying, and your owner dentist says, can you do root canals? It's a tough answer, but, and not but, as someone who runs Dentist Job Connect, being able to do endo can be a very valuable skill for the practice. So that's why your coaching at eSchool is the key to kind of fill in that gap there. Next question, getting the XR to look like a master cone to have a good fill, even fill in each canal. Any comments on that?
So it sounds like they want to have a sexy root canal at the end. Is that, am I interpreting?
I like that. Yeah. I like that.
They want that sexy look, right? Again, when you have consistency, when you learn key principles, and it's funny because people are like, oh, what file system do you teach? And it's not about that. It's when you really understand the concept, you should be able to pick up any rotary file and any piece of gutta percha and get the job done. And this is important for associates that maybe work Monday, Wednesday, Friday in this office and Tuesday, Thursday in this office, and they have totally different systems. So very, very important to learn, but again, it's so simple. Like even warm vertical is so simple. And when you can simplify it, then you can get that nice, dense obturation, that radio opaque look that everyone's looking for.
I like that comment. Someone asked in the chat, how do you know if you've thoroughly cleaned out the canals?
Well, you got to give it time. So the 30-minute endo is not going to work. A lot of your instrumentation and your cleansing is going to come from irrigation and your sodium hypochlorite. So this is a time when you can go do your hygiene check and let your hypochlorite just sit and marinate in the tooth.
Yeah.
So it's more about allowing the hypochlorite to take action as opposed to figuring out, oh, do I need to go to the next file? Does that make sense?
Yeah, for sure. I think that makes a lot of sense. We talked about it, and this person in the chat's so awesome. She's on Nachos, and I know dental students and new dentists want us to have some number. Someone asked me about I'll answer. So if someone said, how many implants give someone enough confidence as a GP? I would say 30 to 40 implants. That's what I would say for implants. 30 to 40 implants, doing 30 to 40 cases, being able to follow them, you're going to start to develop confidence. The challenging part is being able to do those 30 or 40 cases. Who's going to help you? Are you going to have C or support? Anything you give for root canal numbers, if a young dentist wanted, saying how many root canals will give you confidence for GPs?
I think that's a good number. 30 to 40 is a great number, but I think the sequence in which you start your endo journey is really important. Like start with your single canals, right? Master that single canal, then go to 2 canals, right? Then master that, then go to 3, and then do the mandibular molar before you try the maxillary molar. I think the maxillary molar should be the last thing that you do, because again, your anatomy could get in your way.
Really good point. We're gonna do about 10 more minutes with Sonia. You guys have been great in the chat. I think I've gotten most questions. I like these from our Nacho audience. This is actually a question I think is important, and just more just your thoughts. Maximum number of appointments for molars. Like if you have one of your eSchool people and they're saying, hey, Dr. Sonia, I work at a practice. I can't work for a long time at one time. I got hygiene to check. How many appointments would you say they should schedule, or what's too many? I'm actually interested in this answer because I wouldn't know how to answer it.
So how many appointments should it take to get a root canal done? A molar root canal done? Is that what I'm
Yeah, how many should it take? And then, what would maybe be too many? If an enthusiastic associate, but one who's like, I don't want to say is annoying their patient, but I don't think they can come for 5 visits for one molar.
Well, I would love everyone to do single visit endo, right? Because then it's profitable for everybody, for you and your patient. So I'm going to say let's shoot for single visit endo. But sometimes your patient's draining, sometimes they're in too much pain, or sometimes it is too difficult and you do need a second visit. I rarely go over 2 visits, and I would say 95% of my cases are single visit. I think if you are continuously and routinely doing 3 visits, you're losing money. And you
Yeah.
should maybe bang out 3 crowns and instead, like, do crowns instead of the root canal. Or really get good at the more simpler root canals until you gain that speed and confidence to, again, grow back up to the molar.
And I think I'll share with you as someone who's, you've given up on class 2s and checking hygiene as an endodontist, Sonia, but someone who has multiple associates working for them. I've been an associate. The reality, whether it's fair or unfair, is that both your team and the patients lose confidence in you when things take too long. You may be trying your best, but just like when you go to a restaurant, if your meal takes too long, it doesn't matter if it comes out perfect. So it doesn't mean to rush. It's just to be cognizant of sometimes it is better to use your case selection, do those easier cases until you get really good, because you do not want to lose the confidence of your team and the patients. And it's a tough part of being a dentist, but I can think back and say, hey, there's cases I've tackled that I wish I referred. So really good point. Over instrumentation at the apical third and bleeding of canals because of it when doing root canals with manual pro tapers.
So if you over instrument, you can induce bleeding from the periapical area, no matter what rotary file you use. I would rather you over instrument than under instrument, if I were to pick one.
I like that.
If that's fair, because I think it's more forgiving. You may induce a little bit more inflammation. There might be a little bit more post-op sensitivity, but eventually that'll go away in about 4 or 5 days. But at least you got all the bugs out. So you're going to increase your chance for success for that case.
Really good answer there. Maybe some, I don't know if they're easy or just some straightforward ones. When do you use antibiotics in endo? Do you not use it ever? Do you use it sometimes? What's the role of antibiotics?
I use it rarely. And I want to urge everyone to use it rarely. Number one, I don't want to give people antibiotics because then they don't schedule. Right? I need them to schedule. So I really only utilize it when my patient's swollen. Like I had 3 swollen patients today, and they had pus draining out of their face and their tooth, and I needed to give them an antibiotic. But for people who have the irreversible pulpitis or that vital pulp, like, we don't need to give them antibiotics. We actually need to do the treatment. So I'd rather get them in quickly, do treatment, and avoid giving them antibiotics and messing up their gut.
I like that. I did was the GPR resident at Albert Einstein in Philadelphia, and we used to have 25 people waiting for emergency. So in dental school, you think an emergency if someone has a rough tooth, right? But when you're in a GPR, you have to be able to triage. So we had, do you have any swelling outside your face or inside your face? Yes or no?
Yeah.
Can you open? Yes or no? Do you have any problems breathing? Yes or no? So people said no, no, no. They already went to not a big emergency, right? And I think it really taught me. And I think then there was an endo resident I actually worked with back in the day, and he described antibiotics like lids on a trash can. So it can help if you have swelling, but like you said, it's not going to solve that problem. And I think that's a really, really valuable point. I want to see if there's any more questions in the chat. I want to talk a little bit more about eSchool. In our follow-up, we will share with you Sonia's webinar here. So I'm going to spend about another 5 minutes with Sonia reinforcing some of the things about eSchool. If you want to ask any other questions in the chat. Well, here's a good one I know you'll like. Sonia's waiting to the end. Because when you came to Boost Camp, you gave an amazing lecture that had nothing to do with root canals, right? It had everything to do with treatment planning your career for success. So some of the strategies that got you to where you are, and you authentically shared, or my team member can share, the Dental Nacho Supreme has Sonia and other people's lecture. It's a whole $99 a year. You can get it. Lindsay will put it in the chat. You can watch Sonia and her crew. But to give us a summary of that lecture, which I love, genuinely said, you were the problem, right? It was my mindset was the problem. So if you were to talk to some of these dentists here saying, how do you get to where you are? What strategies for your career? Where should they get started?
Always focus on yourself. don't worry about, other people. I think it's easy to blame everyone else but yourself, but see where you can fix yourself. That was really, for me, I remember I used to always blame my team, or this person sucked or that person sucked. And really the problem was me. I wasn't communicating right. I wasn't consistent for my team. There were so many things that I needed to do better. Um, and I'm so grateful for all the people in my life who were my mirrors and showed me how I could be better, because that's really the only thing in my control is what I do. So,
I love that. I want to share. Lindsay, get a screenshot of us. You can text RCT to 215-543-6454 to get a discount on Dr. Chopra's amazing e-school and coaching. Sonia, what do you wish you spent money on? I'll answer on. What do you wish you spent money on earlier in your career? You were either too cheap or too unaware. You can't spend money on something you're not aware that it exists. So if you could go back in time and say, hey, young Dr. Sonia, I wish I spent money and time on energy on this sooner, what would you say to that?
so I think I found coaches really too far into my life. And now I've had a gazillion coaches. You can get a coach for anything. You can get an endo coach. You can get an implant coach. I have a feminine goddess coach right now. Like it's just, like you can get a coach for anything. You can get a business coach. I think starting with coaches, working with somebody who has really been through it before you have, and you can learn from their mistakes. That's really, really important.
I echo similar things. I'm going to add that I actually was, I worked at a restaurant. I've worked at hospital systems. So I hired coaches early to help with team management, right? Earlier than most dentists. I said to my dad, we got to get our team on board. One thing that I regret is I didn't hire what I would consider to be business and profitability coaches soon enough. I was in network with bad dental insurances much longer than I wished I had been. I used feelings instead of facts. It's like the calories on a menu. I said, I'll worry about it later. And if I could go back, I wish I hired someone to really help me look at my P&Ls, my insurances earlier in my career. I was very concerned with my culture, very concerned with people getting along, which is important, but I didn't pay a close enough attention to that. And that's something you talk about at Boost Camp, because why they don't talk about in dental school, but profitability is important. Why is it important to a practice?
It's huge, but also I think it also is so important to understanding your worth and what you do, and protecting your energy at the end of the day. I freaking hate insurances. Am I allowed to say that now?
Yeah, you could say it.
Okay, I hate it. I'm so glad I finally went out of network. I'm like everyone else. I had to start my practice in that way, but eventually I realized, oh man, I'm actually a pretty good dentist, and I should get paid for what I'm doing. And when I started to run the numbers and see, that's actually one of the biggest ways I was able to do the production of 2 days in one. So,
I mean, I would share that identifying, don't go and drop all your plans tomorrow. Don't go and sign up for all your plans, but make a plan about your plans, and don't be like us where we didn't pay close attention. Someone asked here, Sonia, I love this question. How do you find mentors along your journey? I'm going to share, a mentor is different than a paid coach. When you pay attention. There was a quote I said, like when you got to pay for something to really pay attention, whether it's a gym membership, whether it's coaching. You can have mentors and people who have your back that you can text and say, I have a problem, but don't confuse those with your paid coaches. Sometimes I think, Sonia, and I think this is done with it, young dentists say, oh, everyone just mentor me for free, and I'll just ask someone else, why is that a challenge to really moving your career forward if you're waiting for free mentors to show up?
well, I like to respect everybody's time, and I never want to take advantage of anybody. And so if I really want like really focused help, I want to pay for that. I want the person who's helping me to feel that I value them. So, and then they're really going to help me.
I know what I'll say is, we're on the other side of it now, Sonia, but I went to every study club I was invited to as a young dentist, because where mentors will mentor you for free at events. Someone's at a bar or having coffee and they want to ask me about their job, I'll tell them for free right there what I think. So the way to get mentors is to go to events, talk to people who you don't know. But when it comes time to really investing in your career, whether it's C or coaching, pick a budget, invest in yourself. You will not regret doing that. Well, you've shared so much awesome value, Sonia. I hope it's not September when I see you at the ODA next. But I know we're on the same lecture in September, right?
I know, I'm excited.
We'll get you boost camp. Anything else about eSchool coming up? You said that January 22nd is the last day to register. Lindsay will put that into the chat.
21st.
January 21st.
Yeah.
I also would like Lindsay to put into the chat. Dr. Sonia and I are here at 8:30 for free. I know you can sign up for stuff, but all of this value and knowledge is totally free. I have a Google link. We love when people leave us nice reviews. We love that at our dental office. We love that in any of areas of our life. So if you can take 20 seconds, Lindsay, just drop that review link. I texted you in there. So Sonia, I'll let you go back to your family, get ready for the storm. Keep me posted on everything going on, and hope to see you in person soon.
Thank you so much for having me. It's always
Oh.
nice getting to hang out. So thanks again. And I'm looking forward to seeing you face to face.
Awesome. Great, Sonia. Thanks so much. Enjoy. I need
Bye,
a goddess
everyone.
coach. Now I need a goddess
You do.
coach. So I'm gonna
Do.
Yeah.
I'll hook you
That's-
up.
Yeah, thanks, Sonia. I'll talk to you soon.
Bye.
Everyone else who's still here on Zoom, so appreciate your time. We are always connecting here to feel less alone. We need any help with anything that we do, just reach out to us at dentalnachos.com or dentistjobconnect.com.